A lot of my patients do Pilates. It's not something I've ever looked at in detail, to be honest. I thought it was just another type of aerobics. How wrong could I have been? What's made me think about it recently is that my wife has started doing a class locally and she thinks it's fantastic. I've noticed that her gait and her posture are better and she's really enthusiastic about it. I thought I'd better have a closer look. Joseph Pilates was German. He was born in 1880 and died in 1967. He moved to America between the wars and developed a holistic system of exercise called the Pilates Method. It concentrates on releasing tension using controlled movements to develop core stability and coordination. Is it the same as physiotherapy? Well, not really. As you can imagine, there's quite a bit of overlap between the techniques that are used. Physiotherapists are trained in assessment, diagnosis and treatment of injuries, disability and rehabilitation after surgery. Pilates instructors generally don't use the techniques of manual therapy that are used by physios. Having said that, there are thousands of physios who incorporate Pilates method into their rehab techniques. The Pilates method involves mat work and it also uses machines like the reformer. Physios often use conventional gym equipment such as an exercise bike, rowing machines and of course free weights. I see that these techniques are complementary to each other. Used together, they can be really helpful in managing hip arthritis before and after surgery. After all, if you're as fit and strong as you can be before you have a hip replacement, then your recovery will probably be much quicker. Is there anything to worry about if you want to do Pilates after hip surgery? One of the biggest concerns that I have as a surgeon is that patients will have a dislocation of the hip doing exercises that are too extreme. To put my mind at rest, I went to see Pilates instructor Gemma Pearson, who works at Winchester Pilates. She's really interested in the potential for Pilates method to help people who have had hip surgery. And as an ex-professional dancer, she really understands how important it is to prevent injuries and look after yourself. She'll talk about her approach to people with hip problems and show you some of the exercises that are commonly used. Here she is.
So I was a professional dancer and always had to do Pilates as part of our dance training and never really appreciated it when you're younger. And then as I got older, I just learned to focus in and spend a bit more time on it, especially when I was working professionally. I think it helped me from injury, kept my body able to do 8 to 10 shows a week, so I'm really grateful for it. So it felt like a natural step. And it's a bit of a cliche to be a Pilates instructor when you're a dancer, but there's a reason for it. There's a lot of similarities, you know, understanding movement in the body. So Pilates is ideal for someone with hip pain because every exercise is adaptable to the client. It doesn't matter where you are or what your ability is or experience of movement. Pilates has something that can specifically treat you. The most important thing is if you know you're going to have that hip surgery is to really start before. And if you can find someone and say, could you do some sessions with me before, or maybe try, you know, and do as much as you can, because the stronger you are, the fitter you are before you go in, the quicker that rehab process is going to be. And do your exercises on your sheet that your physio gives you. Post-surgery, it really has to come from the recommendation of your surgeon. Yeah. So once you've had your clearance, and I mean, hopefully it should be 6 weeks, I think it's best to be as educated about your condition and your hip as possible because you know your body better than anybody else. You know? And also, I think majority of Pilates instructors do, but not everyone is specialist in rehab. Luckily, everyone here at Winchester is really experienced. So these are exercises that can be done 6 weeks after surgery, guarantee that the surgeon has cleared you. Ideally, I would have something a little bit higher, but we're going to start with a little half squat, okay? So you're going to have soft knees, and you're just going to slowly hinge the hips back as if you were kind of sitting on a high bar stool, and then stand up nice and tall. And the idea is really that we create that hinge action. So a really great way is to pop your hands in the hip crease, soft knees, and you're folding over the hands, keeping that spine straight and lifting up. And the idea is that we want to engage through the bottom, so the hip extensors really want to start to strengthen them up after surgery. Working after 6 weeks, really want to be lying down comfortably. If you can be lifted up off the floor, ideal. And just being able to lift the knee and then slide the leg away, okay? What we're conscious of is what's happening in the pelvis. So ideally, good places to put the hands on the hip bones and check that we're not rocking and rolling. We want to keep in what we would call neutral. So that just means the spine's in its natural position on the floor. Now, a progression from this would be to start with the knees at 90, to slide the foot away, and it's important that you keep the foot in contact with the mat. Once the foot or leg levels out, you're going to flex the foot. Dig the heel in, so that's going to engage through that hamstring, and pull the leg back to 90 and change. And we're watching out for ribs arching off the mat, pelvis arching. We're trying to train that pelvic stability. By digging that heel in, we're getting those hamstrings to work and engage, which is really important after surgery. We want to strengthen glutes, hamstrings, inner thighs. Okay, so the next exercise we're going to do is a bridge. So the idea is that we're working those hip extensors, so glutes and hamstrings. Ideally, head wants to be flat on the mat in a nice, comfortable position. Feet hip width apart, hands down by your side. We talk about that spine being in that neutral position. So it just means tailbone is heavy, lower back is soft. So you can just glide your fingertips underneath the small of your lower back, and the ribs are in contact with the mat. Okay, chest and collarbones open, hands down by your side. You're going to press your hips up towards the sky. Now you're going to go as high as you feel comfortable, okay? Might be here, might be a couple of inches. And then from there, we want to articulate down. So you're going to think of softening your chest into the mat, scooping your abdominals, and rolling down through the spine, okay? So by pressing up, we're engaging those glutes and hamstrings, and rolling down, we're articulating through the spine.
It was fascinating to listen to Gemma and to hear how the Pilates method has helped her throughout her career, and of course helped so many people maintain and develop fitness, poise and balance. I'm sure that this approach will be really helpful for people who are thinking about hip surgery or who have already had it. If you're thinking about doing Pilates, then please check with your surgeon to see if there are any precautions that you need to take that are specific to you. Make sure that the Pilates instructor has experience of dealing with people like you, and if they don't, then ask them to recommend someone who can help you. I'd really like to thank Gemma for her time and for sharing her expertise with us. If you'd like to know more, then please get in touch. The details are below. They're in the description box, and I've included a link to Winchester Pilates as well. Thanks for watching, and I'll see you again next time.